Hello, I'm Dr. Adrian Larson, and in this video I'm going to talk about how AcuGraph makes you a better acupuncturist. In acupuncture, as in any other healthcare field, you're only as good as the information you have to work with. AcuGraph gives you more information and a broader perspective to synthesize with other methods and give you better outcomes. Whether your approach is TCM, 5 elements, Meridian therapy, or any other approach to acupuncture, AcuGraph gives you additional insights to help you get better results faster. Take, for example, this case, who is a real patient. This 58-year-old female sought treatment for stabbing pain in the shoulders, upper back, and right hip. Her pulse was thin and wiry, deep and weak, with the kidney pulse barely recognizable. Her tongue was peeled, red, dry, and dusky. The TCM diagnosis was blood stagnation with yin deficiency. And this matches the AcuGraph findings, as you can see from this graph, where the kidney is the most deficient of all the meridians. Therefore, if this were your patient, you might start by strengthening the kidney. But let's take a closer look. An important question to address is why the kidney is weak, particularly given the symptom picture. So, let's look at another one of AcuGraph's innovative graph views. This one shows the meridians in the order of energy flow to give a better idea of how the meridians are affecting each other. As you can see, there's plenty of qi flow in the heart, small intestine, and bladder, but the energy isn't effectively reaching the kidney. Therefore, the root cause has nothing to do with kidney deficiency itself, but rather the blockage in the qi flowing from the previous channels. In this case, excessive energy is held up in the small intestine and bladder channels due to tendinomuscular stagnation blocking the flow to the kidney. In fact, all of the deficiencies in this graph, including stomach, spleen, kidney, and gallbladder, can be tied to excess in channels that run through the neck and shoulders. It's obvious that the shoulder tension is playing a major role in blocking proper qi flow. So the approach was to treat this patient's tendinomuscular channel imbalances in the shoulders. The result? The kidney deficiency resolved. While this approach is different than a TCM pulse diagnosis by itself, you can see how the larger picture provided by AcuGraph gave context for the TCM diagnosis and an effective approach to eliminating the cause of the primary imbalance. Of course, with AcuGraph, your follow-up exams show the results of your treatment, so there's no need to rely on symptoms alone to determine your effectiveness. Where else does AcuGraph shine? Here are some other common scenarios you've likely seen in your practice, where AcuGraph helps get better results faster. First, the laundry list patient. Sometimes the patient presents with an array of problems that can't be tied to a specific pattern. AcuGraph gives you insight by giving you a snapshot of channel energy flow so you can work through layers within the problem. Doing so quickly reveals the underlying root condition and brings rapid relief of symptoms along the way, as well as allowing you and your patient to track their progress. Another scenario is the preventive care or wellness patient. Patients who come in for a monthly tune-up appreciate that AcuGraph recognizes imbalances before symptoms evolve. This allows you to educate your patient about living a balanced life to prevent imbalances from becoming problems. Both you and your patients will appreciate the AcuGraph approach to preventive wellness. And AcuGraph gives you power beyond the pulse. Some say it takes 30 years to become excellent at pulse diagnosis. But who has 30 years? AcuGraph gives you greater insight you can combine with your pulse diagnosis to get the complete picture. Internal pathways, musculotendinodiagnosis, energy flow, root versus branch, and meridian balance all combine with your other diagnostic approaches to give you the best diagnosis and treatment and add a new layer of confidence to your practice. Thousands of acupuncturists worldwide use AcuGraph for greater insight, accuracy, and results. Shouldn't you?